Hi everyone, this is Dr. Erdoğan by Smile Hair Clinic. Today I want to evaluate a patient, 1-year result patient with you. So I will start to check the photos, before photos and after photos, and I try to explain the things what we did to the patient and how it is resulted. So let's start with the patient's photos first. Our patient is from Italy and he's 31 years old. We had a 4,800 grafts implantation done in March 2022, and we are now evaluating the March 2023's photos. So it's 1-year result that we will discuss right now. From front, as you see, there are some miniaturization in the frontal part. Especially he had a disappeared hairline. His hairline is already receded back. There are irregularities, very tiny, thin hairs, which is called miniaturized hairs. And he also lost some of the hairs. So sometimes the hair loss occurs in 2 ways. Sometimes the hair just becomes thinner, which is called thinning and miniaturization process. Or sometimes it becomes the whole hair will fall off. In the miniaturization process, it also falls off. But in the both way, we lose the structure, we lose the density and how the hairline has to be. We lose this thing, and mostly that brings patients for a hair transplantation. Once he chin down, he had both temporal part recession. Plus, we can see still in the frontal part, not very high density because the mid part should be very strong, and he doesn't have so strong hair. So probably this is a photo, of course, but under a strong light, sunlight, or if it's wet, probably it's gonna be appear lower density. And a crown area. Of course, with the male pattern baldness, we see sometimes recessions from the frontal part, with including the hairline disappears, but merges from one temporal part to other temporal part. In the same time, we also expect some crown area lower density appearance, so he had this too. Okay, so these photos, of course, we talk with the patients about what is their expectation with the hairline or expectation with their planning. A patient wants to lower the line a little bit more than his actual condition, so we make a lowering hairline. It seems like straight here. I will show from other aspects as well how it looked like, but we decide these things with the patients. Of course, we have some proportions that we want to measure the face according to 1/3 ratio or horizontal or vertical junction, which shows us some point, and we start the hairline from there. Or sometimes we just decide about the race or ethnic background. Asians, Afros, white Caucasians have different proportions in the face. But usually we decide this thing together with patients' previous photos. They bring us photos that they had their hairline before. Or sometimes we see some hairs and we take those hairlines as a guide to create the line. So with him, there are already hairs here, that he has already hairs. Sometimes when the existing hairs are very low, we do not want to start, if the patient has not enough graft, we don't want to start from the higher point, because there will be a gap between the implanted hairs and the existing hairs, which is not a good thing. A patient need to shave, or patient need to make epilation or hair laser removal to hide these things. But as you see, we draw the line, the proportion seems very okay. You can see there is a semicircular area which shows us the frontal part, including some temple point design transition, which I'm doing for some patients if they need or if they want a real frame. We decided this with the patient, so we did the frame as well. But of course, here is like total restoration, the frontal part, the crescent area. Then the frontal part seems very low density, so we need to increase the density in that area. Here you can see the temple point. I want to explain you something about this temporal part thing. Sometimes the man has a triangle in their temporal parts, and in the temporal point, sorry. In the temporal part, there is another triangle. It's called Z part. So we want to have that Z shape or that triangle angle in some patients, but sometimes because of the hair loss, it disappears in some patients. And Sometimes patient knows that it's disappeared and they want to restore it. At that time, we tell patients if it's not totally disappeared, to do is it's a risk for his future, because the recession or the hair loss may continue, the implanted hairs will remain here, and the recession goes further back, so there will be a gap. So he needs to come for the transplantation. That's the first thing. And the second thing is we need to really find really thin, very tiny, very single hairs suitable for that area. Yes, sometimes we see it, or sometimes we dissect even we can't find single ones. But still, the transition is really different, and we need to find real good hairs for a good appearance. Because here we can't understand or notice that he had a hair transplantation, but if it is different, it will be very noticeable because you are looking from everywhere to the temple point. So it should be very done properly with a surgeon who knows doing temple point design with superficial angle, direction, and also the graft selection. Okay, so this is unshaven part, but let's check right now once we shave what we see, because sometimes longer hair makes it more fully appearance. Even as you see, the studio photos and the pre-op photos are different. Sometimes patients send us from overseas their photos for evaluation or for having some plan, but sometimes we give the plan or code or how many grafts it's going to be implanted, but it differs when the patient comes here and when we see in the naked eye and during the planning process. Anyway, another photo with the crown. Yeah, it's quite large. The calculation of the crown was nearly 100 centimeters square just for the crown area. Or of course there are hairs there. There are hairs that we need to protect those hairs, and we need to increase the density in that area. But as you may know, as we are telling this every time, the crown area success rates are lower than the frontal part. So we need to, I will explain more things when we see the post-operative photos. So this is the shaven photo. By the way, he has a nice scalp. His proportion seems good. First, probably I did this line just behind, but then probably we agreed with the patient to take it little front. Yeah, this is a better photo that we can, I think. Yeah, this is the donor area. So guys, you know that we extract the grafts from the donor area, and I want to tell you something very important. I think this is the crown area, and crown area sometimes recedes until the donor area, which is some kind of appears in this patient. As you see here, this part is a little different than the upper part, which means this is called the safe donor area. It means these are testosterone resistant hairs, and they are permanent hairs when we transplant to the recipient side. But above it or below this line, below the donor area, if we take those hairs, sometimes we take it, of course, because we need graft number. If we just stuck on the safe donor area, it will be around 2,000, 2,500 grafts. But if we are willing for 4,000 or more grafts, we need to take out of the safe donor area as well. But these hairs are more prone to have a hair loss. Actually, we warn or we tell patient to use some medications afterwards. Okay, so this is a better photo. As you see, the both temporal part, we can't see the other left part, but the right side, it gives a clue for us. Sorry for bad angle. You see here, it is a total need to be restored area. He had the hair, he had the fringe. That fringe covered probably that area in the previous photos, in the studio photos. In the more light photos, it was okay, but now when we shave it, it's totally need to be restored. Other thing which is important is this frontal part. Sometimes I'm seeing in the other videos or patients talking to each other. For example, they see that there are hairs implanted on this area. Yes, we need to implant some hairs to there. But how? We are using magnifiers, or we are doing some tumescent, which expand the tissue to separate the graft to implant something between those hairs. If there is a possibility of implanting a hair between those hairs, we want to do it, because otherwise, if we make a strong both temporal part and if this middle part is not strong, the patient will be not satisfied in the end result. That's our concern with the patient. If it is done in the right hand for this part, it is, if there are two hairs really, they are becoming thinner. There was a hair between, it lost. So if we have the gap, we do the implantation to that area. But if not, if there are two hairs, if there is a possibility of doing incision and implantation without damaging those hairs, we want to do it. Otherwise, that two hair, if becomes more thin or if stays like this, it will be still not satisfied with the result. So yes, we do between those hairs, but it doesn't mean that we damage those hairs. It's more visible maybe here. You see, there are thick ones. These are very thick hairs, but here he loses its structure of very thin hairs. So it changes for sure. By the way, patients ask me every time, one side is more, one side is, it's always like this. It's always asymmetrically receding. I have never seen very symmetric receding. Even it is very close to each other, it has differences. This patient has also, his left side has more hair, his right side has less hair. In the front he has some hair. We want to use the existing hairs always inside the line, including the line, because even whatever we do in our best, the existing hairs are giving us some density, homogeneous density for a natural look. What we did to him, 4,800 grafts. So how we did, that's the important thing. Yeah, as we talked, we had two priority, front and crown. Mid scalp was good. We didn't do so much mid scalp. Temporal parts in the left and then the right side, it was fully implanted. And here it is less, but of course this photo or just after the operation, the wet appearance water, it seems like it's like full, but it's one by one, it's implanted like that. So we created the line, we fill both temporal part, we increase the density in the mid part. Then in the transition part, we still do that and the crown area. Yes, we did the transition here. Also, sometimes even we draw, I think we got some criticism from some points that it's too sharp maybe, but no, actually whatever we draw doesn't mean we do the incisions in that way. It is always a round, smooth transition, so it gives the good result. We will see in the end results as well. So there are very different irregularities, which gives the naturalness for the hair and good restoration. Okay, so you're curious about the result. I will show you. First month, very early. Third month, it starts to grow at that time. And crown is sometimes a little bit delayed. But even this makes patient happy or even better than however he was here. Routine is, it differs from patient to patient, but 6-month result will be 40–50%. He is a little bit more quicker. 9 months, much better. Still areas. And final result. Let's talk more with the final result. First, he changed a lot. It's good. He changed a lot. He has a nice appearance. His hairstyle is different maybe, but you can't see a line. You can't see a very proper line. Of course, this photo doesn't give us that thing too, but still it looks very natural. It's not very noticeable. Also the side here seems good. But if it is the first thing in hair transplantation, if it's not noticeable from even you are close to the patient, or if you take the photo and if you check it, it means it is a good result. Donor area, perfect, nothing. Of course, when we make it short, we will see it more, but we want patients to use a little bit longer than some point if we take high graft number of if the patient has some multiple session. But he's using, I think, like this, so it's okay. Very small area just left, a little lower density appearance, but overall it looks good. By the way, sometimes longer hair seems more, longer hair shows more hair loss actually, because it cannot cover the other areas. Shorter will be covering more, but even with the light, with the good light, he has a good appearance here. This is the end of our patient evaluation. I think he's super happy with his result. We are happy as his result as well. I try to explain this case with you. I hope you enjoyed it, and if you have still questions, we are ready for answering them. Thank you so much.